And we'll move next. I believe we have Tim Miller, Dr. Miller's video up.
Hello, I'm Tim Miller. I'm a neurologist, neuroscientist at Washington University in St. Louis, and I'm delighted to share with you some of the results for the studies of Tofersen. I want to start with my industry collaborations, in particular Ionis Pharmaceuticals, with whom I've had the pleasure of developing antisense oligonucleotides, and you'll hear about one of those today. And also Biogen, with whom I've had the pleasure of running clinical studies, and I'll discuss with you a Biogen-led clinical study. As this group likely knows well, most ALS is sporadic or singleton, but about 10% of the time it's familial. And within that 10%, approximately 10 to 20% is caused by mutations in the gene SOD1, or superoxide dismutase 1. So if you're doing the math, that's about 1 to 2% of all ALS. And in the United States, that's about 300 to 350 people with SOD1 ALS. And though I'm not showing you, don't have the numbers for you today, regarding the prevalence of SOD1 ALS in different countries. It is recognized in many different countries, though of course the numbers vary to some extent per country. SOD1 is superoxide dismutase 1. It causes approximately 1 to 2% of all ALS. It's a genetic change. So one letter in the genetic code that's changed, and that leads to toxicity to neurons from the abnormal protein that's produced. Lowering abnormal protein should decrease toxicity. That's the hypothesis that we're testing. Tofersen is an antisense oligonucleotide that's designed to lower the SOD1 mRNA and thus the protein. If you think of the human body analogy to a house, you think of the DNA as a set of blueprints or instructions of how to build and maintain a human body. The RNA would then be a rewrite of that set of instructions, less complicated. And then proteins would be the stuff in the house, a rug, a chair, the wiring. And when there's a change in the genetic code, there's a change in the RNA. And that change in the RNA and that set of instructions leads to building, instead of a normal protein, building a toxic protein. And when that toxic protein builds up, it leads to damage to neurons. Antisense drugs can block disease-causing RNA and proteins by blocking the RNA. So they block, or you can think of it as erasing, deleting that abnormal set of instructions. And when that's not there, then you don't produce the toxic protein. To discuss the results from the phase 3 SOD1 ASO Valor study. In the study, SOD1 was lowered. That's what this drug is designed to do. Neurofilament, a marker of neuronal damage, was reduced. The primary endpoint, the slowing of disease on a functional scale, was not met at 28 weeks. But if you look out at 52 weeks, then you begin to see that people on Tofersen stabilize or may even show some improvement. This was a relatively small study with 72 people on drug, Tofersen, and 36 people on placebo. There's a loading dose period where people in the study received 3 doses in the first month and then received 1 dose about once a month after that. The Tofersen, like other antisense oligonucleotides, does not cross the blood-brain barrier. And so it's delivered intrathecally, and that's shown here, delivered into the CSF space at the lower part of the spine. And then after delivered here into the CSF space, it distributes all throughout the brain and spinal cord. I'm going to show you a couple of slides that look similar to this. Those that received the drug from the beginning in red, or we're calling early start. Those received placebo at the beginning in blue, and they're delayed start. Because at 28 weeks, this dashed line down the middle is the beginning of the open label extension. This is the time when everyone who wanted to was able to go on the drug. And this first piece of data shows that SOD1 in the cerebral spinal fluid was lowered. That's what the drug is supposed to do, lower the levels of SOD1, and indeed it does lower the levels of SOD1. We also looked at neurofilaments. Neurofilaments are structural proteins. They're intermediate filament proteins They are part of the structure of axons. And you can think of axons as the wires that connect the brain and spinal cord to muscles. In the setting of ALS, these axons or wires degenerate. And the stuff within them, the neurofilaments, leak out into the blood and to the CSF. As you might imagine, neurofilament leakage is nonspecific. There are many diseases where axons degenerate, and as shown here, other neurodegenerative diseases like Alzheimer's and Parkinson's also have elevated levels of neurofilament. But in ALS, it's higher. So it is noteworthy that in ALS, the levels of neurofilament are particularly elevated. And the neurofilament levels matter in the setting of ALS. So if you look out here at 4 years after onset in a group with high levels of neurofilament to start, only about 20% of people surviving. Whereas if you look at this group with low neurofilament to start, and look out here at 4 years after onset, about 60% of that group surviving. So neurofilaments matter. In the setting of this study, those on Tofersen had substantial lowering of their neurofilament, as is shown here. And the group on placebo, once they got on drug here at 28 weeks in the open label, also had substantial lowering of neurofilament. Our interpretation of these data is a substantial slowing of the neurodegenerative disease process. We read out function by the ALS Functional Rating Scale. This is a 48-point scale with 4 different subdomains. You start with 48 points and lose points as you go. And at 28 weeks, the primary readout for this study, there was not much difference between those on Tofersen versus placebo. The primary endpoint was negative. But yet, if you look out at 52 weeks, you begin to see the difference between those that were early start placebo versus those that got Tofersen from the beginning. And you begin to see also stabilization. And I think this is best illustrated in my favorite piece of data from this published study, which is handheld dynamometry, or strength. It's a composite of a number of muscles showing strength. And you can see the group that got Tofersen early has stabilized. And when we dug into this further, those that got the drug early, 27% of the participants that got the drug early have an increase in muscle strength. And I think, as many of you know, this is a really remarkable number for people living with ALS. Just for the 27% in this study showed improvement. And consistent with this, there were multiple really remarkable stories. I'll just share with you a few from the FDA Advisory Committee meeting. This is a woman with SOD1 ALS who says, since that first dose, I'm doing things I could not do and had accepted I would never do again. My limp has gone from an obvious disability to barely perceptible. I can go into my office again because I'm able to get up and down the subway stairs. I can shower without my shower chair. 43-year-old gentleman said, I feel my ALS has slowed down since taking Tofersen. I've noticed my voice has gotten stronger, and having been in a wheelchair for months, I can now walk short distances that I haven't done since before Tofersen. There are some side effects that are noteworthy, in particular myelitis radiculitis, papilledema, increased intracranial pressure, aseptic meningitis, and some others. These occurred in 7% of those on Tofersen and did not occur in placebo. Some conclusions. Lowering SOD1 lowers neurofilament, and this, our interpretation of these data is a substantial slowing of the neurodegenerative disease process. At the later time points, you see stabilization of function, breathing, and strength, and in some, evidence of improvement, which, and then there are some remarkable individual stories from this study. Overall, Tofersen was well tolerated, but there are some noteworthy side effects, as I discussed. The 2-year data from this study will be presented by Dr. Meritzakovich later this week at the ALS M&D meeting. For sporadic ALS, I would consider discussing genetic testing. For symptomatic SOD1 ALS, discuss Tofersen with your neurologist. And for asymptomatic SOD1 gene carriers, discuss Atlas. And I've shown you the link there to the study. Atlas is focused on the asymptomatic gene carriers, or discuss a monitoring plan with your neurologist. In the United States, Tofersen has been named Qalsody, and I think, as many of you know, this drug was approved by the FDA in April of 2023. Some milestones. This is the first genetic therapy for ALS, the first FDA accelerated approval for ALS, and the first drug to show really substantial slowing and also improvement in the setting of ALS. Some thoughts about lessons learned for all ALS. Many viewing this may not have an SOD1 mutation. I think for me, the most important lesson is that ALS is a treatable disorder. Improvement is indeed possible. And that's really important for all of you to know, and for those of us who are focused on drug development for all ALS. It's important for us to know that if we have the right drug, we can have a substantial impact on the disease. Of course, in my opinion, Tofersen is the right drug for SOD1 ALS. It's also important to understand that ASO delivery to the cerebrospinal fluid can be effective. This enables many other programs in ALS that are coming through, both for genetic and for sporadic forms of the disease. I think from this trial, we also learned that it may take time to heal. 6 months was not enough for Tofersen for us to see a major effect. It took out to 52 weeks to be able to see those larger differences. So it may take time to heal. I want to recognize the many groups that have been involved in this over the years, as shown here. Also want to give a shout out to the study participants, the brave volunteers in this study, and their caregivers and their families. I want to thank them immensely. Also want to recognize the steering committee, as is shown here, and the principal investigators, and their very hardworking site staff, and my colleagues at Biogen, Steph Fredette and Toby Ferguson. I thank you very much for your attention today.